Nebraska is home to about 10,400 civilian federal employees. The Omaha World Herald just reported that 2,400 federal workers have been furloughed on Offutt Air Force Base. We can expect potentially significant economic uncertainty from the shutdown, particularly the longer it goes along.
Educate, inform, inspire. The Dan Parsons Show, a podcast that lifts up instead of tearing down.
Hey, welcome to the Dan Parsons Show. I am your host, Dan Parsons. Hey, coming up on today's show, Dr. Rebecca Firestone with OpenSky Policy Institute. We're going to geek out over the federal government shutdown and what it means for everyday Nebraskans. But before I introduce Rebecca, a reminder that we're quickly approaching the premiere of our 100th episode later this week. As you may recall, we recorded the 100th episode in front of a live, raucous, fun audience at a swanky cocktail lounge a couple of weeks ago, and it's ready for prime time. And if you don't want to wait till later in the week to see it, if you're a friend of Dan, our Patreon support team, it's live over there right now. Just go to patreon.com and look up the Dan Parsons Show. And if you're not a member, join. It only takes a minute to do that. Not only will you be supporting with your hard-earned cash this production, but if you join during the month of October, we'll send you a free Go Fact Yourself t-shirt. Compliments of our friends at Raygun, the greatest store in the universe. So go on over to patreon.com and sign up. Okay, here's my interview with Rebecca Firestone with OpenSky. Enjoy. Well, it is my pleasure to introduce Rebecca Firestone, the Executive Director of OpenSky Policy Institute. OpenSky is a nonpartisan policy research think tank located in Lincoln, Nebraska. Rebecca, welcome to the Dan Parsons Show.
Dan, thank you so much for the opportunity. It's really a pleasure.
Yeah. A little background. Dr. Firestone holds a Doctor of Science in Health and Social Policy from the Harvard T.H. Chan School of Public Health, a Master of Public Health from the University of Washington, and a Bachelor of Arts and Anthropology and Asian Studies from Vassar College. Did I get that all right?
Yeah, from Vassar College.
Vassar, yeah. Well, yes, so thank you for coming on the show. I've been wanting to have you on the show for a while now. So, and I want to talk about the federal government shutdown and how that's impacting our lives here in Nebraska. But maybe before we do that, Rebecca, just give our audience maybe a quick overview of OpenSky and the work you do here in Nebraska.
Sure. So you did a fantastic job of generally describing our work, Dan. We're a nonpartisan, nonprofit policy research organization. We have a mission to use research, strategic communications, and coalition building to advance evidence-based policies that improve economic opportunity for all Nebraskans. What that means in practice is we focus on tax and budget policy, health policy, and education finance for the state of Nebraska. Most of our time is spent analyzing policies in the Nebraska Legislature, but in a situation like this, when we're looking at a federal government shutdown that affects how federal funding flows to all states, we're spending some time analyzing the potential impacts of what's happening in Washington, D.C. to try to make sense of it for what it means for everyday Nebraskans.
Yeah, that's good. Well, I know you're very well respected. Your group is here in the state, and especially I know legislators and public policy folks rely on you guys a lot. So thanks for the work you do.
Well, thank you so much. We do our best.
Yeah, darn right. Well, let's get into this. Let's talk about the status of the government shutdown and how it is impacting the state budget and Nebraskans overall. Dive in. Help us understand.
Okay. Sure. So maybe it's helpful to start with what a federal government shutdown is.
Yeah.
A government shutdown occurs when Congress has not passed a budget to appropriate funds that federal agencies rely on to operate. Funding the federal government is Congress's responsibility, and it generally has to happen in a bipartisan manner, regardless of who's in the majority and who's in the minority in Congress. This shutdown, however, seems to be unique in a few ways that I'll try to draw out for all of us, but specifically in ways that are concerning for their impact to our state and to Nebraskans overall. Shutdowns have occurred in the past. The most recent one was in 2018, and before that, there was one in 2013. So these happen periodically, and they've happened across Republican administrations and Democratic administrations. So it is sort of a feature of how the federal government seems to operate these days. So during a shutdown, non-essential federal employees are temporarily furloughed, which means they can't work and they don't receive a paycheck while the shutdown is ongoing. But there are essential workers, such as TSA agents, active duty military, and those folks have to report to work, but they also don't get paid during a shutdown. Those are normal shutdown conditions. To date, federal employees have always received back pay after a shutdown ends. And in fact, a bipartisan law in 2019 signed by President Trump at the time guarantees this back pay for essential workers. This shutdown now in 2025 seems to be different in a few ways. The Office of Management and Budget is the office in the White House that manages how federal agencies spend those funds. And this office has issued some directives that seem to be maximizing the scope of federal work that would stop and the number of federal workers who could go unpaid. So OMB, the Office of Management and Budget, released a memo on September 25th recommending mass layoffs of federal employees instead of temporary furloughs in the event of a shutdown. And in fact, just this afternoon, on Friday afternoon, reduction in force memos are going out to federal agencies. And I'm going to pull up my notes on this.
Yeah, please do. Yeah, I just saw that, Rebecca. Yeah, please keep going.
It looks like, according to the Washington Post, about 16,000 federal employees are subject to a reduction in force today. But that reduction in force wouldn't take effect for 30 to 60 days minimum, which is at a point when the shutdown is hopefully will be over, is likely to be over. So the impact of the guidance that's coming out from OMB today, I guess, is to be determined. But typically in previous administrations, again, Republican and Democrat, the guidance from the Office of Management and Budget has been, let's have temporary furloughs, not this type of reduction in force. It's also worth noting that these reductions in force and efforts to reduce the overall size of the federal government have been going on throughout this administration from the beginning of this year. A number of those have been legally challenged. There are questions as to why would the conditions of a shutdown change the legal nature of how federal employees are actually hired and fired. It's not clear under law that they are. And what we see in past efforts by administrations to cut the federal workforce is if you do it on a broad-based manner, you can end up inadvertently letting go staff with really key skill sets. And then you need to hire those folks back. And that can actually be quite expensive for the federal government. And I think we're seeing that this time around, for example, with the National Weather Service, where they let go of some staff earlier this year. The ability to do weather forecasting predictably was affected. And now the National Weather Service is having to hire federal workers back.
Yeah, those are great points, Rebecca, because DOGE, as you mentioned, alluded to earlier in the year, that was the reduction of a lot of employees. And I guess, again, not to put you on a spot with all of your education and degrees, I didn't see a constitutional law degree in that mix. So please feel free to bump this question. But we seem to continue to have these questions about the oversight authority of Congress with the Trump administration. And I think here's another example. I mean, I have a hard time understanding where is Congress's role in this? And I guess, that's TBD, right?
Sure. That said, it is written in the Constitution and in statute that Congress has the responsibility of funding the federal government. Congress has the power of the purse. And I think what has happened throughout this year has led to some of the conditions that have kind of meant that the federal government was headed towards a federal shutdown, because even after Congress agreed on a continuing resolution to fund the federal government through September 30th of this year, some actions were taken where the executive branch didn't follow through on what Congress had laid out in terms of how the funds were supposed to be spent. And the federal government, the executive branch has tried to claw back or rescind some funding. So, for example, funds for after-school programs were withheld earlier this summer until Senator Fisher and a few other Republican senators called for their release. We've also seen some disruptions in other federally funded programs here in Nebraska. So, for example, with public media. So it seems to have sort of created this condition where there are some people in Congress saying, well, we can come to these funding deals, but how do we know that they're actually going to be enacted or executed, which has led to a lot of tension, which I think is somewhat unprecedented.
Yeah. Well, that's a great overview. Thanks, Rebecca. Okay, so how is beyond that, and I guess the possibility of some of those obviously federal workers right here in our own home state, what is kind of the broader hiccups or touch points with the shutdown, and why the Democratic Party and the Republican Party are at butting heads on this, and what is the impact for those of us here in Nebraska?
So I think, draw out some of the specific impacts of the shutdown, and then I want to get to some conversation about premium tax credits, which is also very much in the mix for the reasons for the shutdown. So in terms of the direct effects of the shutdown, Nebraska is home to about 10,400 civilian federal employees. And the Omaha World Herald just reported that 2,400 federal workers have been furloughed on Offutt Air Force Base. And just as a point of comparison, when ConAgra left Omaha in 2015, that led to a reduction in 1,500 employees.
Wow, that's a really good comparison.
So, when we work on state policy, we think a lot about the time when ConAgra left the state. We lost 1,500 jobs. At this point right now, just on Offutt Air Force Base, we're looking at 2,400 federal workers being affected by this shutdown. And about a quarter of Nebraska's state budget comes through federal funding. That kind of puts us on average for how much funding we receive as a state to do the work of the state from the federal government. One of the programs that is in question now with the federal government is SNAP, also known as food stamps. So about 150,000 Nebraskans, or about 1 in 8 Nebraskans, participate in the SNAP food program. So that is providing them with food security on a month-to-month basis. Right now, we know that SNAP benefits are expected to be delivered for the month of October without issue, but there's real questions about whether or not the SNAP program will be able to continue to deliver benefits in November, depending on how long the shutdown goes along. So these efforts, the potential of withholding pay for federal workers or letting go of federal workers, the pressure on healthcare, insurance premiums for thousands of Nebraskans, we'll talk about that in a bit. All of that just makes it really harder for Nebraskans to be able to pay for essential goods and services. For example, groceries, just to know where your paycheck is coming from on a month-to-month basis. And, our neighbors here shouldn't have to choose between putting food on the table and having access to decent health care. But the conditions of the shutdown are likely to create that kind of tension for everyday Nebraskans.
Well, and that's not to mention, we are seeing the economic impact of tariffs, for example, here in Nebraska. Farmers are starting to really worry about this crop that's coming in, because We don't have any markets, and a lot of these farmers, a lot of ag leaders are comparing today's situation with the terrible 80s crisis in the agriculture. And so there's enough pressure on our economy already, even without this. So
Sure. And shutdowns have been found to lead to a decline in gross domestic product. So we can expect that there will be an effect on our economy from the shutdown. That is the case in previous shutdowns. And this year, our economic projections for Q4 for the American economy are coming in well below expectations. And that's just because of some of the economic uncertainty we've already experienced this year. So we can expect, I guess, further potentially significant economic uncertainty from the shutdown, particularly the longer it goes along.
Well, you mentioned it, and so maybe let's get into it. I mean, certainly one of the biggest concerns that I've been reading about is just our health insurance.
Sure.
And the impact that it could have on thousands of Nebraskans who are in the marketplace for the government health care. And so talk a little bit about the ACA and, again, the impasse in Congress over that
Sure.
policies.
It's hard to believe that affordable health insurance for agricultural producers, for small business owners, overall for about 110,000 Nebraskans is potentially a political lightning rod.
Yeah.
That is the number of Nebraskans who receive tax credits to help them to purchase health insurance on the ACA marketplaces. And Congress seems to be split as to whether to extend those premium tax credits to those who receive them, and if so, for how long. Just as some background, these premium tax credits were a provision that was created during COVID and then extended. They are specifically designed to make accessing health insurance on the marketplaces affordable, potentially to the extent that your premium could be as low as like $10 a month. We've got some analysis about what is potentially at stake if these tax credits are not extended through some sort of deal. And it particularly in Nebraska seems to be a real challenge for folks in our 3rd congressional district. So just as some examples, a 60-year-old couple making $82,000 a year living in our 3rd congressional district, which is sort of generally central, northeastern, and western Nebraska, could see a 363% increase in their monthly premiums.
Wow.
Going from paying about $581 a month to $2,687,000 a month.
That's not doable, I expect.
Yes, I think that will be really, really hard for the folks who are participating in the marketplace. That is small business owners, it is farmers, it is people who are self-employed, who can't access health insurance through an employer. And so they go to the marketplace in order to be able to get health insurance. And we all know that health insurance works when you have a wide, balanced pool of people who are insured. That's the way to get it to function. So taking people who can at least afford coverage out of the pool runs the risk of actually increasing healthcare costs for all of us, even for those of us who have employer-provided insurance. So from vasectomies to vaccinations, anywhere in between, a broken bone, visiting your doctor, it's bad news for all of us if our healthcare costs go up, if these premium tax credits are not extended through some sort of deal.
Yeah. So what is the sticking point? I mean, and again, I know you have a great relationship with our federal delegation, your day-to-day activity with the Nebraska Legislature, but what has been the reaction from our congressional delegation so far? I haven't heard a lot, quite frankly. People just pointing fingers so far.
Yeah. The House is not in session this week,
right.
so that doesn't make it easy on the House side to be able to have negotiations, and so much of the action seems to be on the Senate side. And I think we're waiting to see. I think what we've heard, generally speaking, from some of the reporting about the federal delegation is that some folks are waiting to see what happens with October 15th, which is when some federal workers will not receive a paycheck that they would have been expected to receive.
Yeah, very good. One other issue, or another issue, Rebecca, that I wanted to ask you about, because frankly, I'm kind of sick of hearing some of the rhetoric back and forth. And that is this misconception that free health care for undocumented immigrants. Could you talk about that a little bit?
Sure. So people who are undocumented are already ineligible for Medicaid. Even before the shutdown, before the big tax and budget bill that was passed this summer, that leads to some real substantial cuts in Medicaid. Due to a law from 1996, Medicaid has long had some substantial immigration-related requirements that block many people, including people with lawful immigration status, from being able to enroll in Medicaid. People with an eligible immigration status for Medicaid are also required to have their immigration status verified by the Department of Homeland Security. There's a couple ways that maybe this talking point has come about. There are about 1.3 million people with lawful immigration status who will become uninsured due to new restrictions that take away premium tax credits from people enrolled in the ACA marketplaces. While Medicaid does provide reimbursement, the other piece of this is Medicaid provides reimbursement to medical providers for emergency services that have to be provided to everyone to meet all requirements to enroll in Medicaid except for immigration status. So those the requirement of the reimbursement for emergency medical services does mean that some providers may end up providing health insurance to people when they don't know what their immigration status is. But those reimbursements don't go directly to help cover individuals. They are helping hospitals, healthcare facilities that provide emergency medical services.
Yeah, thank you, Rebecca, for clearing that up, because I'm just kind of sick and tired of hearing this narrative that is simply not true. Well, I guess there is a semblance of truth to it, but so thanks for that, because anyone who walks into an emergency room and cannot provide payment under the law, they are provided free care. And, they're not asking for documentation. They're not asking for, whether they're a citizen or not. They're providing care as their Hippocratic oath as a physician provides, requires. Mm-hmm. And so anyway, I'm just...
if I can just add on to that.
Please do, yeah.
Some of the reason for that provision, if someone shows up in an emergency room with some sort of infectious disease, it needs to get treated, because if you're not treating it, there's a real chance it could end up spreading to someone else. So that, I think, was some of the original rationale for that type of provision, is that you want to, I think we learned from COVID, from other disease outbreaks that we've seen recently in Nebraska, that you want to treat those communicable diseases real fast in order to make sure that other people don't get sick, because that actually... it puts more people at risk. It also costs more if you don't get on top of it quickly.
Yeah. One of the other issues I wanted to chat a little bit about is going back to the rural healthcare and our rural hospitals and our rural providers here in Nebraska. And again, I think there's been some confusion with the so-called big, beautiful bill. And what is going to be the impact on those rural hospitals and rural providers here in Nebraska. So maybe talk a little bit about that, and again, how that relates to the government shutdown.
Sure. So there is a $50 billion rural healthcare transformation fund that was established as part of the passage of Congress's big tax and budget reconciliation bill, the One Big Beautiful Bill Act that was passed in July. That was put in place to shore up some rural hospitals. But quite frankly, the $15 billion amount of the fund doesn't really come close to the estimated $155 billion cuts in Medicaid spending that are likely to result from the One Big Beautiful Bill. So this program spends out $50 billion a year over 5 years, which is less than a third of what's being cut. It's also concerning that this rural healthcare transformation program doesn't have guardrails in place that guarantee that the funds are actually going to go to rural areas. Half of the funds will be distributed evenly to all states. So Massachusetts has 3 rural hospitals. Nebraska has 66 rural hospitals. And of that amount, Nebraska and Massachusetts are going to get the same allocation of funding. So there's more work to be done to follow what the Centers for Medicaid and Medicare Services are going to do in terms of how they allocate the funds. But it's really not a sustainable long-term solution to support our rural hospitals. It was a negotiation to try to help the bill get passed. So what does it mean in terms of the shutdown? It seems like there's some efforts in Congress to try to reopen some of the negotiations around Medicaid that occurred to get the tax and budget reconciliation bill passed back in July, and some interest potentially in going back to the Rural Healthcare Transformation Fund. That said, there's plenty of work to be done, probably if one were to continue with that program, to try to shore it up, to really make sure that there's some guarantees that it does go to rural areas. And we'll just have to see what Congress does. I mean, certainly investing in our rural hospitals and making sure that they are sustainably financed is an important policy goal.
Yeah. That's really great. Thanks, Rebecca. That's really helpful. All right. What else are we missing? What's your prediction of when this stalemate may end? And and then I just want to ask you real quickly about the upcoming legislative session. But anyway, your thoughts on how this may end and when it may end.
Well, I am not a professional watcher of Congress. That said, when I talk to folks in Washington, D.C. who actually are, they have said we should not be prognosticating at this point in time. There do not seem to be active negotiations that are happening between Republicans and Democrats at this point in time. And truly, to get a bill, just because of the way that Congress has worked out, there's going to need to be some sort of bipartisan negotiation, because that's how you're going to end up getting a bill passed in the Senate. So it's really, Dan, it's just hard to prognosticate at this time. This is a fairly unprecedented circumstance.
Yeah. Well, we'll keep watch. I know you will. We'll keep in contact. Not to put you on the spot, but it's not very long where we'll be convening the new legislature here in a few months.
Yep.
And so, and there's some budget constraints and budget concerns. I just read your newsletter today, and you guys are working hard on a lot of different stuff. So anyway, just I would ask you for some positive news. I don't know if that's possible, but just give us the straight. We're all about facts here. So
yeah, what I can do is give you some facts, Dan.
Yeah.
So we're looking at currently right now on the general fund financial status is a $95 million budget shortfall. We are going to be watching the Economic Forecasting Board, which meets at the end of this month, very closely to see what the forecasting board does. They are the folks who will look at our economic projections and our tax receipts for the state and try to project out what revenues are going to look like for the coming legislative session and the next biennium. One of the things at OpenSky that we're watching very carefully is the changes to the tax code that could result because of the One Big Beautiful Bill Act that was passed in July. Again, that was in many ways was a tax cut bill. It cut taxes for corporations, for businesses, for individuals. And some of those changes in our federal tax code, they roll on down to the state level. So we are actually looking at a estimated $217 million reduction in state revenues because of what was just passed in July at the federal level. Nebraska is not unique in that way. A lot of states, many states who are already struggling with budget shortfalls on their own are now looking at a further hit to their revenues because of that bill that was just passed. So there are some opportunities potentially to decouple or delink some of the tax code on the state level from the federal level. That would be one way to be able to protect some of our state revenues, to make sure that it continues to go into healthcare, into education, into helping make sure that we are growing our state's economy, which is a really key role for the work of the state legislature. So it's kind of hard from a budget perspective at this point in time, Dan, to be able to really lay out what things are going to look like for this next legislative session. I think we just know that we'll see what the Economic Forecasting Board does, and we know it's going to be a busy session from a budget front. There's likely also, I think, going to be some work around what happens with our healthcare programs, just because of the changes to Medicaid, SNAP, some of the big federal programs that direct a lot of funding to the state that the Nebraska Legislature will likely need to contemplate as a result of the bill that was passed back in July.
Yeah. A lot of work to be done. There's job security, right, Rebecca? Let's wrap up. Tell our listeners and viewers how they can learn more about OpenSky and get some of that great data that you guys are working on.
Sure. So our website is OpenSkyPolicy.org. Some of the facts and figures that I just shared with you, Dan, are on that website, so people can go there to learn more. Sign up for our email list. We put out a newsletter almost every Friday that gives a rundown on fiscal policy considerations for the state, and also provide some information about how to engage with the Nebraska State Legislature. I would also say, Dan, at this point in time, truly, there's never a bad time to be in conversation with your congresspeople and your senators. If you care about the state of Nebraska, they all care too, very, very deeply.
Yeah.
And, we know that they're listening, and they have wonderful staff people who are also, whose job it is to listen to Nebraskans, to listen to their constituents, and to be able to share that feedback with our elected officials.
That's a really good point, Rebecca. Let's not be so cynical about the political mess that we're in, that we don't reach out and have conversations with our elected officials, because that's
certainly there's always time for polite, constructive, thoughtful conversation with our elected officials.
Yeah, let's lift up instead of tear down.
Anyway. Absolutely.
Okay, Dr. Rebecca Firestone, thank you for your time here on a Friday afternoon. And everybody's seeing this probably on Monday, but anyway, enjoy your weekend. Thank you for updating our audience on these important issues, and please come back.
All right. Well, thanks so much, Dan. It was really a pleasure to be on this afternoon, and look forward to another opportunity.
Hey, thanks, Rebecca, for your time today. We'll continue to follow the effects of this federal government shutdown and how it's impacting our lives right here in Nebraska. In the meantime, say thanks to the Parsons team who made this show possible. Mr. Chase Porter, our executive producer, Ike Samanis, producer and graphic design, Penology Tech Solutions for their technical help, and Kim Remington, Parsons PR's Director of Operations. And my sincere thanks to each of you for your support and for tuning in. Okay, that's today's show. Thanks for tuning in. Now go do good things. I'm Dan Parsons.